Classic Country Kicks 101.5 and all the Sky Communication stations now present Sunrise over Selma, the special talk edition with Cindy Fisher. Cindy, good morning. How you doing today?
Good morning, Todd. It's going great so far.
Yeah, so far, so good. Lots to talk about. We got a lot of great guests this morning to tell us what's going on in the world of the COVID-19 coronavirus locally here. So you want to tell us who all we got?
Well, we have David McCormick, who's the CEO of Vaughan Regional Medical Center. He's going to come on and talk to us a little bit about what the task force has been talking about and how many cases they've seen come through, which isn't many, but they've done lots of testing. We also have the Dallas County Superintendent, Hattie Shelton, and she's going to talk to us about how things are going with the homeschool world and distance learning. And we have Mayor Dario Melton is going to join us as well, talk to us about the curfew.
Great. That sounds like a great lineup. We ought to get started. I tell you what, why don't we get to David McCormick on the line? Because I know that a lot of people are interested in the testing, and we want to talk to him about that. How does that sound?
That sounds great.
And remember, this is live radio with only one person running everything up here, so forgive us.
Yes, we are in separate locations doing our social distancing,
Right.
and quarantining. So be patient with us, but we still are able to reach folks that are at home and get information that is so important for Dallas County and Selma. So that's the best part about technology and the fact that Todd knows what he's doing.
Well, I wouldn't go that far. Good morning. Is this David McCormick?
This is David McCormick at Vaughan Regional Medical Center. How are you?
I'm doing well. This is Todd and Cindy, and over at Kicks 101.5. Thanks for joining us this morning, Mr. David. How you been?
I'm well. Can you hear me well on my cell phone?
Yes, sir. I hear you fine. Can you hear me okay?
I sure can. Thank you.
Yeah, all the social distancing, like Cindy's at her house, you're at your house. I'm the only one in the studio. So we're doing everything live radio by the seat of our pants and just having a good time doing it. Real radio. It's fun.
Yeah.
Getting everybody the information.
Yeah.
So,
but actually, I'm at work. I work, so I don't get to stay home.
There you go.
I'm like you.
Amen.
Like you.
Amen to that. Let's see, Cindy, you want to ask him a question, see if he can hear you with this new setup here.
Yes, I would. Hi, David. Good morning.
Good morning, Cindy. Thank you for having me.
So we have some statistics. We heard that you on the task force phone call yesterday. Wanted you to share with us what you guys talked about, and from Vaughan Regional's perspective, how many tests have we seen, and put it into perspective how much you're seeing here in Dallas County.
Well, we're very fortunate so far. I think that people are following the government's direction. They're staying home if they can. They're trying to wash their hands. They're staying away. They're doing the social distancing, like you said. We have, at our facility, we have collected samples on, I think, 35 people. And the testing is all done really out of state right now. Big labs out of state. Everyone's sending it out. It's unfortunately about a 7-day turnaround. Going to get a lot quicker, I think, with some of the new testing. But anyway, we've had 35. We've only had one positive. This was a patient that came in just to be tested. Fortunately, they didn't receive any other services at the hospital. They wore a mask, so we're protected from that. But that's the only one that we have that's been confirmed here. The second one in our county, from what we hear from the Alabama Department of Health, was a resident of Dallas County, but was treated at UAB. They had some severe injuries not related to the COVID, and when they tested them several days after they had been at UAB, they tested positive on their machine. So they could have caught it up at UAB. Who knows?
So they were actually at UAB in Birmingham, not the UAB Family Medicine here in town.
No, sir. Yes, that's right. Exactly. They were UAB at Birmingham, and they just tested them up there for some reasons. But they were up there not for COVID. They were up there for some internal injuries. They had an accident. So
Oh.
so fortunately, we're not seeing a lot. We are going to because it is out there. It's spreading. Everybody's out there. From what we hear, it's starting to get a little better at some of the larger areas like New York. But fortunately, in Selma, I think social distancing, people have done that. We're a little isolated, but we've not really had the impact. Now, fortunately, the hospital is prepared. We have the supplies that we need. We're part of a big corporation, and they were really on top of this early. So we're right now we're not feeling the effects of it. But if it does come, we're ready for that.
I've got some numbers, the latest numbers as of this morning. Dallas County, again, just with 2 cases confirmed. Wilcox with 3, Autauga 7, Chilton 11, Bibb 3. Those are the closest counties to us. Shelby 86, 282 in Jefferson, and I think Montgomery is right at 100. Perry County, however, 0. But I think it's like you say, the somewhat isolation, rural areas, and people willing to follow the guidelines.
Yes, and I think people have really. I've been impressed by the way people have handled the situation. Our staff here has really done a great job. I know everyone's a little on edge because it is a scary situation, but everybody's still working hard. We deal with a lot of sick, ill people anyway. Some a lot worse than the SARS. The COVID situation. So we're prepared on that. But yeah, the community I think is really banded together, and people are staying home, and people are paying attention. So that's really been a good sign.
What about PPEs? We hear a lot about the personal protective equipment. You guys are well stocked in that?
Well, now fortunately we're following guidelines and we're not wasting it, and that's what happened in some places. Everybody kind of went a little crazy, and they overutilized it when they didn't need to. So we're following the guidelines. Our staff are wearing it, but they're wearing it appropriately, and we're not wasting it. So we've been able to get what we need. It's still. If a crisis happened, it would be very, very difficult. But right now, fortunately, we're not in that crisis situation here in our community, and we've been able to use the equipment the way we're supposed to, not waste it. We are using a lot more because a lot more people are wearing the masks and the gowns. But fortunately, we have, in Selma at Baum, we've been able to get what we need.
What about ventilators?
We have, I think I've got to remember the number from yesterday, but there were still in our state either 400 or 800 ventilators that were available in our state that are not being used. Here at Vaughn, we've not gotten close to. We have 8 ventilators, and we use an average of about 5. So we've not got to a point where we're out of ventilators yet.
What?
But these were patients, just normal patients. See, these are normal patients. This is a normal thing we go through during this time of year. Fortunately, the weather's getting better, and that should help some of the respiratory situations. But we usually use 5 to 7 ventilators on an average anyway.
Could you tell, because there's a lot of people may not understand why ventilators are so important as related to the COVID-19. Why is it that we need ventilators?
Well, this is a respiratory illness, and when it gets into the lungs, sometimes the lungs start to shut down. So we need the ventilator to basically help the person breathe. And until we get the antibiotics in there or whatever needs to be done to get the lungs cleared up so they can start breathing on their own.
I saw a story, I believe it was yesterday, that Ford and GM have stopped automotive production and are producing ventilators. So that's going to be. I think they wanted to like 400,000 by Easter or the end of April. So I forget the exact number and deadline, but I guess if you're a Ford man or a Chevy man, you're going to be all right. I'm gonna put me on a Ford ventilator, okay, please.
I have a question for David. So you've been in the healthcare industry for a long time. Have you ever seen anything like this before?
We have seen we've seen flu seasons that were very, very bad. I can say bad, where a lot of people died. I have never seen the reaction that this country has had to this situation. And, you've got both sides of the coin. Some people say we're overreacting, some people we're not. And I tell you, I think that the government's doing everything they can to prevent this from becoming a real crisis like it could become. Fortunately, though, so far it has not, it has not really been a crisis in our community or in our state. Now, New York, of course, is different, but I know I have not seen something like this on either side, either the reaction to it or the illness itself.
Right.
It does seem to be something that is, at least for our generation and the one before us, it does seem to be uncharted territory, definitely, in many, many ways.
Yeah.
Cindy, you got any more questions for David?
How are the nurses doing? How is morale?
The morale is good. Unfortunately, our volumes are down. We're not allowed to do a lot of procedures because people are staying home. So that's kind of tough on trying to get people their hours and things like that. But overall, the staff is handling it very, very well. I've been very impressed. And I just looked up yesterday. We have 800 ventilators in our state that are not being used. On an average, we have in our company 90 hospitals across the country, and currently in our ICU beds we're less than 50% capacity. And so that means there's a lot more capacity if this surge does hit. But we're just hoping it doesn't happen.
Amen to that. We certainly don't want that to happen.
Right.
But I guess it would if it became a problem. There's a lot of hospitals that are asking for more nurses, but I guess those are in areas that actually have really heavy infections and or high numbers of infections. Our area, we're not to that point, correct?
That's correct.
Yeah. So,
What about telling people if they, I don't know, slice their finger while they're cooking, or I know that I've heard a lot of the urgent care centers saying we're still open, telling us that their drop in number of patients is pretty significant. Should folks fear coming to the emergency room for something that's not related? I feel like a lot of people are kind of dealing with it at home and not coming in. What kind of messaging should we give them?
Well, and I think you're right. People are afraid of that. I've had several calls from different people. As soon as they get here, we put a mask on them. Our staff are wearing masks, and that's pretty critical. And if you need to be treated, you need to be treated. The thing is, we want people that don't need to be treated to stay home. And if you've just got, a little sore throat, or you've got a little cough or a little fever, then stay home. But if it does get to be serious, then you need to get in here. If you need to be sewn up, if you cut your hand, or if you've got chest pain, or you have other things, you need to get to the hospital or urgent care, because it could turn out to be serious. So you're not going to come in here and catch it, because I think we've got it pretty well controlled here.
and with that in mind, could you remind us of the policy that you now have about visitors and visitation at the hospital?
Yes, and this is a state mandate that we're not allowing any visitors in the hospital. Now, there are certain situations. If a mother is having a baby, certainly the father can come in. If a patient is passing away, then we let family come in and have their last time with them. So there are several exceptions, but overall, we're not allowing people, any visitors, to come in. It's been very difficult, but I tell you, all the people coming to the hospital have been very cooperative about that, and they understand the situation we're in, and we've really not had any issues at all with that.
Oh, that's fantastic.
That's great.
Yeah, that's good. Cindy, you have anything else for David?
I think I'm good. Our main goal is to make sure we get the information out there that helps this community stay grounded, because I know this is easy to get anxious and have a lot of misinformation. So through the radio station, the newspaper, and this show that's combined, we're hoping to make sure we get the information out there that everyone needs, so that they don't freak out in this situation. And
I think that's
we're
great. I
very
think
happy
that,
to have you on, David, to help us do that. Thank you.
well, we're, anything we can do to help the situation, and y'all are doing that also. There's a lot of groups in the community that are showing that concern, and I think people are paying attention. You can go to our website. We've got a lot of information on our website. The Alabama Department of Health has information on their website. So there's plenty of information out there. The key is stay home if you can, wash your hands a lot, don't touch your face, and the social distancing, and I think we're going to be fine.
Sounds great. And that's VaughnRegional.com, correct?
Yes, sir.
Vaughn Regional. And I noticed, too, on the website, you have a lot of links to, like, the CDC, Alabama Department of Public Health, and whatnot. So if you go to VaughnRegional.com, there's other links that you can go to that are good, trusted sources for information.
That's correct.
Fantastic. Well, David McCormick, thank you so much for joining us and giving us an update on what's going on at Vaughn Regional Medical Center. And we do definitely appreciate what y'all are doing over there.
Well, we appreciate y'all for getting this message out, and let's just continue to keep our community safe.
Sounds good. We'll be in touch for more updates soon. How's that?
That sounds great. Thank y'all very much. Y'all have a blessed day.
You too. Thank you.
Thank you.
That's awesome, David McCormick. He's a really good guy. He's really fun. I got to tell you something real quick. That when they had that public safety meeting about 3 weeks ago, he made a little joke, and I said, "Well, I heard that." He said, "What was it?" He said he heard that something would kill the virus. I said, "Well, I heard that a good shot of bourbon would kill the virus." He says, "Well, I don't know, but I'm gonna go home and test that theory right now." I mean, he just got that kind of.
We all want that to be the cure.
Yeah, wouldn't that be a great cure? But the beauty of it is his personality and his personal. He's very personable, and I think we're in good hands with Vaughn Regional Medical Center. So that's good to know.
And he also has a great love of the Selma community, because
Yeah,
he did come from outside of the community, like me, but has real dedication and appreciation of this community. So what he's doing for us as a community is from his heart.
Exactly. And, and speaking of the health issue and the health situation and things to do and not to do, I think I said it a couple times yesterday, but I wanted to reiterate the fact that there was a viral video that's seen well over 16 million views of a general practitioner somewhere, I think in Ohio or something like that anyway, was saying you need to wash your vegetables and your fruits with soap and water and soak them in the dishwater and all that. No, the experts say don't do that. Do not, because the soap is toxic to your body. And fruits and vegetables are living things with pores. And those pores will absorb the soap. And when you rinse, all the soap does not rinse off. And it can do gastrointestinal damage and cause pain and diarrhea and upset stomach and all kind of problems. So the best thing for fruits and vegetables is to rinse them in cold water. Now, I would rinse them an extended period, which, that's, I guess it depends on how long do you normally rinse them. Well, rinse them twice as much now. I rinse mine for a while and then, but do that. All right. Let's get Mayor Melton on. We've got the curfew. So let's. Oh, Cindy, I'm sorry. I was going to get you to introduce yourself at the top of the hour. Just dawned on me. I forgot to do that. Let's for the folks that have just tuned in. Who's Cindy Fisher and what's the Selma Sun?
Right. Hi. I'm Cindy Fisher. I'm publisher and owner of the Selma Sun. We are a weekly newspaper here in Selma that is shining the light on Selma and Dallas County. We come out, and we are a print edition, comes out every Thursday, and you guys can find copies at various stores. Usually we're inside stores, but right now we're not inside stores, but we are still available at news racks. So we have news racks that do not carry the virus.
There you go.
So come by with some quarters and grab a copy and get more information about your community and what we're doing. We've got some really great stuff in this week's paper that comes out tomorrow, and it has some of the fun stuff people are doing around Selma, Dallas County during this quarantine.
Oh, that's fantastic.
And right. So yeah, our office is on Alabama Avenue if you have any need for past copies. We also Our online social media is big for us and our growing our audience. So find us on Facebook and follow us, and you'll be kept informed all day.
I can't wait to get my, I have the honor of writing for the paper, but I don't see everything in it till it comes. It's always exciting to me to get my copy so I can see what else is in there. I know what I wrote. I don't
Yeah,
see everything
you
else.
kind of own the front page this week, Todd.
Oh, wow. How cool is that?
Some great stuff.
I love doing the writing. That's fun stuff, too.
And one of the things was about the crime stats improving, which we can talk about during this hour.
Yeah. Is this Mayor Daryl Melton?
Yes.
Hey, Mayor Melton, this is Todd. We're live. Wanted to talk to you this morning. Thank you so much for joining us. How you doing?
I'm doing great. How about yourself?
I'm doing real well. Oh, Lord, I just got a beep. Wanted to ask you quickly, first of all, you know Cindy Fisher. She's on with us. Cindy?
Hi,
Hello,
Dario.
Cindy. Hey, Cindy. How you doing?
I'm doing good. I hope you're well.
Wanted to
Doing
ask.
great.
Want to ask you about the curfew. Now, we had an extensive interview the other day that we played on the stations about not only the curfew, but about some people not paying attention to, like, parks being shut down and whatnot. We kind of wanted to go on and reiterate the fact that what the city's doing, why we're doing it, and what are the repercussions if you don't follow the rules.
Well, again, thanks, Todd, for giving me an opportunity to speak to the people again. It's very vital and important. As you can see, this is deadly serious. Numbers are rising in the United States, and in Selma, we are doing all we can to try to prevent the rise in Selma. We placed a quarantine in place, shut down all city buildings and city parks, and the police department, under the leadership of Chief Wolford, has the authority to cite people who are in violation of the quarantine. As you see with the state government and also with the Department of Public Health state director, people can be fined up to $500 in 180 days in jail. So it's very serious when we come to protecting the health of citizens inside of the city and the state.
Well, and it is. Now, I noticed on some social media that there was a lot of people, and there's always naysayers, and there's always people that are going to knock down everything that one person does or doesn't do. And they're saying that it's too little too late, or it's not any good because it's from 9 to 5, 9 p.m. to 5 a.m. What good is that? Nobody's going shopping then anyway, that kind of stuff. What would you say to those people that say this is not an effective measure?
Well, those people are not health professionals. I'm taking guidance and lead from the governor, who's been led by Dr. Scott Harris. You can see Montgomery and Birmingham, their times is from 10 p.m. to 5 a.m., and so our time is even greater than the Birminghams and Montgomery, the bigger cities inside the state. The politicals out there is shameful during a crisis that they would, instead of working together, they continue to sow discord inside the city. It is my prayer and hope that people do not listen to such ignorance and focus on what's really important here, and that's saving lives inside of our city. And again, no one has to go outside their house at all. We put that measure in place so we can enforce it. And so people can choose for themselves if they want to violate the quarantine and reap the consequences of it. Because we also have a city statute that states if you know someone who has a disease, a communicable disease, and do not share it, then you still can be cited for that as well. And so any individual who's brazen enough to go against legal and health care policies, I just, my prayers and thoughts are with them.
And again, it's not that the city's trying to be the bad guy. And it's not that the city's trying to be, overreaching or whatnot. It's just this is a serious situation that needs to be handled with serious measures in order to get it to end as soon as possible.
Right, and the thing about it, we have 2 documented cases in Dallas County. So anybody who says it's too late, that person is not on the same planet that we are. When is it too late? When you're saving lives, it's never too late to save lives.
Amen to that. Amen. And what else? The parks are shut down. The buildings, the city-owned buildings are shut down as well.
Correct. All events are not allowed to be held in city buildings, and as you heard from Dr. Scott Harris, any gathering of 10 or more people, again, can be considered a violation. And so this is serious, not just in Selma, but it's serious throughout the state and serious throughout this nation. The president just last night saying they're expecting between 100 to maybe 240,000 people who would die from this coronavirus, and we're just at 3,800 right now. So again, anybody who thinks this is not serious, again, they must not be on the same planet that we're on. This is life changing for the United States, and life, I believe, would never be the same. This is actually changing how our culture operate and function. And so I know people are uncomfortable. There's a lot of fear out there. But at the end of the day, we have to make tough decisions. That's why we were elected, to make tough decisions, not to placate to those people who were trying to sow discord and score political points during such a crisis.
There you go. And that's the thing. You can't go into office thinking you're going to make friends, because you probably won't. But in the long run, you got to do what's best for the people in general, regardless of what side of the fence you're on. So that is much appreciated. Now, some of the areas around Alabama, like Jefferson County, has a shelter in place. I know Lauderdale County, Mississippi, just issued one yesterday. That doesn't look like it's on the table yet for Dallas County and Selma, does it?
Well, along with that, the city council actually have to come to me, and I have yet to have them to come to meet. I've asked 3 weeks ago, and you have yet decided to meet about this coronavirus. So it would take both branches of government to make that happen. The reason we have the quarantine in place because the law will allow the mayor to proclaim a quarantine without the council support. The council will have to vote on the curfew. Now, the health department can come to modify the quarantine I have in place. And so those individuals who feel like, again, 9 to 5 is not long enough, the health department can come in and say, well, we can make it longer than that. And so that conversation is not just the mayor conversation. That's also the healthcare professional who can come in and weigh in on that quarantine.
And of course, the actual quarantine proclamation itself is available online at the city's website, correct?
It's available online, and if you see it, it's the same measures that Birmingham and Montgomery are taking, and Tuscaloosa are taking. So Selma is not the only city doing. The difference between ours, it had to be a quarantine because the council did not vote on it. But they have a curfew that basically our quarantine mimics their curfew.
I see. And the curfew is the council and mayor votes. The quarantine is by proclamation.
Right. Well, the mayor doesn't vote on curfew.
Right.
Mayor doesn't have but the curfew that the council will have to vote on, and the mayor will have to execute the curfew.
Right.
But quarantine is simply a proclamation during a healthcare crisis or a natural disaster that the mayor can make.
I got you. I understand. Well, is there anything else that we need to let the people know from your office right now?
I think it's important and imperative that people practice social distancing as much as possible. I have a lot of people contacting me saying, well, can you get the grocery stores and other stores that are allowed to remain open to limit the traffic inside the stores? Now, government cannot mandate stores that have been allowed to open, but what we can do is encourage stores to try to practice social distancing. I've seen several stores that are allowing just a few people in at a time. But when you're talking about grocery stores, I know that may be difficult. But again, we encourage social distancing even inside of the grocery stores. And please, those who are listening, let's make sure our senior citizens have the opportunity to buy supplies and food for their homes. Let's not stock up everything and leave our senior citizens out there to dry.
And on that note, I do know that Dave's Market has not only online shopping, where all you got to do is go online, pick out what you need, pay for it online, just drive up and pick it up. They're also, their first hour of business is dedicated to senior citizens, so they can, because they're the high-risk group, they can get in, get what they need, and then leave before us young bucks go in. And notice I'm calling myself a young buck.
I hear that.
I wish I really was, but point is the lower risk people can go in later in the day, and that way, because a lot of people don't realize, I may not be in a high risk category, you may not be, but we could be carrying the virus and it not show symptoms in us, but we could still pass it to somebody else, which is why it's important if you're in a low risk category to still practice the social distancing.
Definitely. I think people don't see the seriousness of this virus until it impacts home. And that's why we encouraging people to practice social distancing, even with their family. One thing is that people want to invite people over to their homes and have family events or hang out with their friends. We strongly discourage that. As you said, we can have the virus and not have any symptoms of it, and can be passed along to other people. And I think staying in place, social distancing is the best thing we can do right now to prevent the spread of this horrendous virus.
Cindy, have you got anything for the mayor?
How about services? If people have questions about if they need a business license, property tax payments, stuff like that, how can they do that? Is there a way online?
Yes, they can go online for a business license. They can contact us online or call phone. Because City Hall is not open to the public, but we still have staff inside of City Hall, as well as the building inspector office, and as well as the tax collector. So there is still the opportunities for people to do that. With business licenses, I think there may be challenges for new businesses trying to open up, basically with the non-essential businesses who may be trying to open up because the governor and the State Department has basically closed down non-essential businesses.
Oh, that's a good point. Yeah,
and so we won't be able to participate in something where we'll be violating the order that came from the state health director and the governor. So it would probably be something very specific for businesses. Other than those people who need to renew their licenses, but new businesses, it'll be something very specific. I think make sure that we're not in violation as a city against the order that's going out.
Fantastic. Well,
Got it.
Mr. Mayor, I thank you so much for being on with us today and clarifying some things. And I hope you have a blessed, wonderful, and healthy day.
You all please stay safe and healthy and continue to encourage citizens to practice social distancing.
Oh, and one of the other things that you have always pushed since this started, and I wanted to get you to reiterate that, is trust the officials and the experts, and not the politico or just some common Joe online.
Yeah, and again, in the civil rights, it was ministers and pastors who led us. It was a civil rights crisis. This is a healthcare crisis. And so we need health professionals, those who understand healthcare pandemics and epidemics, to lead us. And so, again, I can't stress enough, let's let them lead us. I'm taking guidance from them in regards to the health decisions we're making for the city. I'm not an expert when it comes to health, but I have to trust those people. And again, it's not basically if you're Republican, you're Democrat, what race you are, what gender you are. This virus has no boundaries. And so we need to work together with those who can lead us in this moment.
Thank you again, Mr. Mayor, and we will talk to you again soon, I hope.
Thank you all so much, and be safe and have a great day.
As Mayor Darrell Melton, City of Selma. So some good advice, especially about, if you want to find out what's going on, you don't, I wouldn't even completely trust, my best friend. I would definitely go to the CDC website, the Alabama Department of Public Health, Vaughn Regional Medical Center's website, the any of the health providers are going to know, and we got plenty of them around here. We got the Rural Health Medical Center medical program. We've got UAB Family Medicine. We got different places you can go for the information that are trusted sources, so that you know what's right. Just like, and granted that video I talked about earlier about the fruits and vegetables was a general practitioner. He's a doctor, but he's a general practitioner. He's not in charge of, or his expertise is not in,
infectious diseases.
Infectious diseases,
right,
and food and stuff like that. So, and another thing is, some things should just raise a red flag when somebody says wash your food with a toxic chemical. That should say, wait a minute. Well, let me double check on this. So you might want to find a way to double check on things that you see or hear about.
And so many people are lonely and looking for their community that they usually see every day on social media. And when that happens, they're just seeing just this massive flow of sharing of stories like yours that you're talking about with the soap on fruits and vegetables. I call it kind of like the Boy Scout or Girl Scout game, where you're in a circle and you whisper pepperoni pizza with, and then you list all these crazy toppings. and they go person to person and see what it is at the end. And
Yes.
at the end of that, it's never even a pizza.
Right.
We that's one thing I think is so wonderful about newspapers, and our stories not only are more trusted, but you can go to them, they're in print, you can cut them out and laminate them, and you don't have to whisper it from person to person and guess.
Well, you can also go back if you misunderstood something. You can go back and double check.
And double check.
Yeah, that's always makes things good.
And webs. We now have online, which is such a blessing. We've had trouble as an industry monetizing, making money off of our website. But I'll tell you, the selmasun.com, our traffic is up like 120%
Wow.
right now. Numbers I've never seen. And that's industry wide, because we know that people are coming to us for the local, super local information, like what
Right.
David just gave us for Vaughn Regional, what Dario just gave us for the city of Selma. No one else, you can't get this from CBS News.
No,
and
no.
and that's the nice thing about our numbers online. We have some items that are shared 400 times.
Well, that's awesome.
So we are in a unprecedented number. So our reach is just terrific right now, and we want to make sure we're able to give the information as we build this audience that's seeing, hey, we can trust our newspaper.
Yeah.
That's something we feel like we've had to rebuild over the last 10 years since we've been kind of attacked and used as an example of what's wrong when they don't like what they're hearing and reading.
Right. It does seem to be that newspaper's been the scapegoat, but not the Selma Sun. It's not a scapegoat.
Well, and our point is to do positive coverage, which is tough to do during this time, but it's
That's right.
informative from a helpful angle, not from a alarmist. And that's big for
Right.
us. Is every wording that we put up, we make sure it's not coming from a perspective to alarm people, and especially just to alarm them to get them to click on a story. We don't need that, because people are so desperate for information. They're clicking on it with a normal headline. We don't have to do a freak out headline to get people to read.
There you go. That's something that's always bothered me. How are your kids doing school-wise right now?
Oh gosh, don't go there. So, as we talked about last week, your kids are full-time homeschooled.
Right.
Mine are formerly public school kids. They're now in a private school setting. They are absolutely used to going to school and being told during the hour of science and the hour of math what to do.
Right.
So we are now in this new era, and coming from the Hoover school districts where we moved from, they were on Google Classroom every day. My kids, they knew they could do distance learning there. Here it's a little different because the schools are smaller, and they were way more one-on-one. So when you switch from a one-on-one to distance learning, it's been really challenging to understand what the workload is, what's due, when, and it was a little heavy on the workload. So the teachers have kind of cut back on that, because we can't spend 7 hours with our kids, 6 hours with our kids like our teachers do, and we're not professionals at it.
Right.
So I will say that they've been very receptive at listening, because our paper goes to press on Wednesday morning at 8 a.m. So we'll be printed here in about 20 minutes.
Mm-hmm.
And I have to put that paper out, but I can't do it if I'm teaching my kids all day.
Right.
So this week was definitely a challenging week, and they're stir crazy.
I bet.
But I do think that a good thing that's gonna come out of this, of schooling at home, is not me being a better teacher, because that'll never happen. What it's gonna be is the kids taking responsibility for their schoolwork. And I have 4th grade and a 7th grade. My 7th grader is already used to being more independent with his schoolwork, and not asking for help and needing somebody right there. My 4th grader is kind of used to having someone right there. So this is going to be, I think, an interesting time where they are going to learn how to manage their time and maximize what they get done during that time, so that they can play after that, because we've tried to do a morning schedule of work, afternoon we do something outdoors and
That's a good
fun.
idea. Yeah. Now, if I can, and mine, of course, came from public school, then went to homeschool. So they've been homeschooled this whole year. So again, it's something that they've already become accustomed to. This is their spring break week, so this week has been,
I gotcha.
so that but
Ours was last week.
right, and for mine, it's business as usual, which has a whole going to a school to homeschooling, a whole new ball of wax. It has this whole new little group of problems that we're having to deal with. But I think they have kind of started to get into a bit of a routine, and of course, Sarah. Luckily, doesn't have to work every single day. So, and when she goes to pick the papers up or goes and my wife actually is the one who distributes the papers.
She's
to
our
the box.
delivery specialist.
Yeah, she's delivery. So, but while she's doing that, the kids are at home doing their lessons because they'll have live lessons online and stuff like that. So they're already set up to do what they've got to do, and then when she comes back, she helps them with. She's what they call a learning coach, and she does whatever questions they have and whatnot when she gets back. So it works out really well for us right now.
I do look forward to talking to the Dallas County Superintendent about
That's what I was going to say.
One of the things we had talked about was the equality issues, because you've got districts with kids that don't have access to internet or very little access, and they can't do a Zoom classroom for every kid in the class because they don't all have access to that. So as much as us parents would love to sit them in front of a laptop with the Zoom classroom going and just do normal school, it leaves out some of the kids that can't afford and don't have that kind of equipment. So I'd love to talk to the superintendent about how that's working. I know we talked to Avis Williams with Selma City Schools last week, and she filled us in a little on how that's working and the feeding program, because a lot of kids in these districts only get their meal at school, but their best meal of the day might be at school. So that's definitely one of the things that we rely on and hope that they've got lots of planning in place.
And that was Miss Hattie's number, so she may not be quite ready, so we'll try her back here in just a little bit. And Miss Hattie Shelton, the superintendent of Dallas County Schools, she's a super nice lady and does a good job. So hopefully we'll be able to get her on the phone here in just a little bit.
And I know they have scheduling for grab and go meals,
right?
Which Selma City Schools is using their parent university bus that they created this year to do grab and go and delivery of and reaching out to the community, going straight to them since they're not coming to school. So I think that there's been a lot of efforts done to make sure that Dallas County and Selma City kids are in good hands.
Yeah, and the bringing up the feeding issue, that's another situation. There's a lot of different charities that are still open and do it, like the Selma Dallas County Food Bank. It's still hopping, and
I bet it's extra busy.
Yeah, it probably is extra busy right now. We need to talk to Jeff about that. I'm supposed to get with him this week anyway. And then I know the Edmondite Mission, the Bosco Nutrition Center is still open, and they've actually added bag breakfast, where you can grab and go breakfast in the morning, and then at 11 o'clock or 10 or 11 o'clock, they start serving lunches, and they too are pushing the grab and go. So, unless it's a homeless situation, and then they have some limited seating for the homeless population.
Right. And I think that's great that they're stepping up for these services that we need to keep doing, and it can still be done without not flattening the curve, without violating any of the curfew, or not curfew, but any of these rules that are trying to keep everyone in their house or at least playing outside. We talked about that last week, about the outdoors. Dallas County is so known for the outdoors. We have so many beautiful things, the river and Old Cahaba, and so many places where social distancing is easy to do because it's a lot of land. I know you guys are going or have been horseback riding on. And I think that is a great option for outdoors things with your family, where you're not um, in a funeral where a lot of them shared, and or a choir practice, which we've heard about. I would think half of the members that went to that
Yeah.
with that choir rehearsal have ended up catching it, and two have died. So, there is a reason that there's a no more than 10 people gathering,
Right.
and really
Exactly.
less than that. Something else I've loved seeing online is neighbors standing out and singing together from their
Yeah.
porches.
Yeah, they started
Um,
that in Italy. Italy was doing that, and then there's been a lot of communities here in the United States that have picked that up. There's even been one in Ohio. I saw a story. I think it was last week. May have mentioned it last week, where they stepped out on the front porch every morning. They do the kids, elementary school kids, do the Pledge of
the
Allegiance,
pledge,
and
yeah,
it,
I
yeah,
think even the teddy bear.
that is
Um,
so cool. Yeah,
and I actually talked to the Children's Advocacy Center yesterday, and they usually do their pinwheel project that's awareness for child abuse, and prevention awareness, which is this month,
right.
April, and they're going to try to send the pinwheels to people, and then and to companies, and have them put it at their place, and then go search for the pinwheels,
Oh, that's a good
which
idea.
might be a fun activity for
Yeah,
kids,
yeah.
just like the teddy bears. In a rural community like ours, which I don't have neighbors that close to
Right,
me, and I know you don't either,
right,
it's not like we can just pop out and sing on our
right.
porch
Yeah,
with our neighbor next door that I can't see, through the bushes. But we do have ways in our rural community, and we do have neighborhoods that might be doing this teddy bear challenge, and I think that
yeah.
would be a lot of fun for Selma.
You had mentioned the outdoor thing. This a couple of days ago, I spoke with Chuck Sykes, who is the director of Wildlife Freshwater Fisheries, which is a division of the Department of Conservation. And I just called him because I hadn't talked to him in a while, and we started talking about business. And he said that some of the meetings he's been in recently, he found that a number of states have been forced to shut down some parks and public areas. However, Alabama is not one of them. So there are plenty of places, as you mentioned a little while ago, like the Forever Wildlands all over the state, and you can go to foreverwild.com and find out where they are. And there's a bunch of them, and they're not very far off, where you can do hiking, boat, canoes and kayaking, and bike riding, horseback riding on a lot of them. There's outdooralabama.com, where there's a lot of outdoor activities. Turkey hunting is underway. All these activities, you can go hog hunting, feral hogs. All these activities do not require large groups. You can take the family, or, dad and the kid can go, or mom and the kid can go, and still have some good educational as well as family time, good family bonding. What they call it, quality time together, and get out of the house for a little while. So
And the weather is so terrific. It's
it's
about
going to
to
be
get
nice for the next
hot
few days.
again.
Yeah. It's going to be
And while
really
it's
nice for the next
not
few days.
hot, let's enjoy. Yesterday it was so windy, and we had some storms come through, but now it's cooler weather. This might even be a great time to go camping.
Yeah. I tell you what, it's going to actually be kind of breezy for the next few days, but the sky's going to be sunshiny, and like you say, it's going to be cooler. So outdoor activity, camping sound like a plan to me. I love doing that. Take the old bus somewhere, park it for a little while. I'm going to try Miss Shelton's number one more time. Let's see
And
if
I
we
know
can get
you
her.
love the buses, the VW bus. So
That's
that
a
is one
fun.
option.
That's
I have
fun.
a Honda Pilot, and it folds all the way down. I think that might make for glamping.
There you go.
I've
Yeah.
thought about it. I've thought about it.
That's called
But
getting creative, and we need to do a lot of that right now.
there's three of us in my family, and my son, the 13-year-old, is about 90 pounds bigger than me. So I
Uh,
don't know if we'll all fit in the Pilot, but we would definitely love to try, and learning how to make a fire. We're city kids, so we're really enjoying this more country, laid back life.
well, that's something that you find out a lot of people. I'm gonna try one more time because I think maybe we need to give it one more try. Miss Hattie's so nice. I really like her.
Your call has.
Yeah, apparently there's a problem, so we'll try her maybe next week or something. But
Yes.
anyway, do you have a tent?
We don't have any pets right now.
No,
I
tent.
had
Tent,
a
Tent.
cat.
Tent, Tent. Tent, camping.
Oh, a tent.
Yeah.
This is challenging not being
Yeah,
in the same room, isn't it?
very much
Um,
so. Yeah.
we do have a tent. Yes.
Well, there you go. Take that and put it up next to your car.
I was gonna say in Hoover, where it was small, we would camp in the backyard.
Oh yeah, we've done that with we put our 3 buses together in the front yard and went camping. We may do that again because of oh gosh, there she is. She's calling on my cell phone. Let me I can't answer it because this is the new the new norm. My cell phone is the way we are communicating with Cindy right now through
And I'm on my cell
yeah,
phone.
it's FaceTime audio, and Miss Shelton obviously not aware of that, so I'm gonna let her hang up from my cell phone, and I'll call her back, because I can't call her on the cell phone right now, obviously. But
Well, we are working around it, aren't we,
th-
Todd?
well, we're using technologies in new ways, so let's try her one more time, and
Yes, and in the future, we're hoping while you're trying her, in the future, we would love to have our shows in the studio and Facebook Live. So there's growth
yes,
to come for our show, Sunshine Over Selma.
yeah. Oh, see, now she's busy. She's still trying. God bless her. She's
Yeah.
trying to call in, is what it is, and that's why I can't get her. So we'll just try one more time here in just a second and give her an opportunity because I really want to hear from her. She's doing some great
Yeah.
things for Dallas County schools, and we definitely want to get her on. So
And so many of our population is being educated through her and the county schools. And
yeah,
I've seen a lot of great. I know Keith High School. They have some videos that they've been putting out, saying hello to the students and kind of keeping connected. And they've definitely been using Facebook for the positive. So
Miss
that
Shelton.
Good morning. How are you?
I'm doing well. Thank you so much. I saw you had tried to call my cell phone, but what we were explaining is in this time of social distancing, my cell phone is the way that Cindy Fisher from the Selma Sun and I are hosting the show because we're in 2 separate places. So I couldn't answer, but thank you so much for calling and letting me know that you are ready to talk. How you doing?
I am well. How are you?
I'm doing quite well. I'm just excited to get you on the phone to give us an update and tell us about what's going on in the Dallas County. By the way, as we were talking about, Miss Hattie Shelton is the superintendent of the Dallas County school system. You're a wonderful lady. You helped me before in the past when my kids were in school there, and you really seem to have a big love for the kids. And so how is things going in this weird situation we're in right now?
Well, because I've been blessed with a wonderful staff of teachers and educators and supporters, our classified staff has been volunteering to help get food to students. Teachers have been helping to get food to students. So we're doing everything we can to stay in touch with our kids, but also make sure their needs are being met as much as we possibly can. The board has been very supportive in the decisions I've been making along the way, and I've just been trying to keep everybody up to date as to where we are and any needs we may still have. We did the plan basically for making sure our kids receive instruction and that their education goes on
What are some
in alignment with what the State Department required, which was a multi-tiered, which was the online as well as possible handing out packets. So our people have been coming in and working on that. Our teachers have been making sure we're following guidelines.
so there's
And
been
we're here.
So I guess there's been a lot of adjustment for teachers as well as students. What about Cindy? Didn't you want to ask about the food?
right. I know that a lot of kids get their best meals sometimes at school. What kind of grab and go kind of offers do you guys have for the kids in Dallas County?
Well, we're doing a grab and go and a deliver. We have some parents who are capable of coming in to pick up. So we have 2 sites that are preparing the meal, but we're delivering in every zone for the students that we have been informed needed meals. Currently, we've been serving about 300 meals a day for the students that we serve. in our area. So we have a site at Brantley Elementary, which is a grab and go, but we also deliver food from Brantley Elementary to some of our students who can't get there. And then in the western zone at Keith High School, we have a group of ladies who have been working hard to be there. The same group has been there ever since the first week we were out, and they've served every day. They've been serving about 82 children, but we do have bus drivers who have said if we have students who are being missed, we will come and deliver to them with the understanding that we're going to keep our distance. We're going to make sure everybody has hand sanitizer. At this point, we're still doing masks, even though we know, they say they may not be as effective. I think that kind of changed last night, but because it's constantly changing, we're doing everything we can to make sure we're sharing food with our kids, but keeping them safe.
Oh, that's awesome.
What
the kids that
can I
need?
just say one more thing? Can I say one more thing?
Oh, by all means, go ahead.
We don't have a site that's still serving from the zone in the southern zone, which is across the river for us, but we do have a group of people who are delivering to the students in that area, and we serve about 125 of those lunches in that area.
If there's any of the students or families that need that service, how can they let you know that they are in need?
They can contact me by email on the Dallas County site, or they can they can phone and leave a message at my office. I do go in a couple of days a week to check and see if I have any messages, if they have a need, because there are kids I'm sure we're probably missing, but we're going based on what our counselors and our teachers knew about our students who might need it extra, and we're looking at how can we get like non-perishable items to our students that they could have possibly for breakfast, but currently we've only been doing lunch.
That's fantastic. Well, very much appreciated, and I know the kids who need it appreciate it. Is there anything else you'd like to tell your parents and students that they may need to know?
Well, what I want our parents and students to know is we are still here. They are welcome to reach out to us in multiple ways, either by email. Some of their schools have their own contact ways, such as Remind or the Class Dojo. So if they'll reach out to their principals, if their principals will let me know, Ms. Shelton, you're missing this section. If they have any needs as far as their assignments for their students, our teachers will be in constant contact in one way or the other, either by phone or through their platform or through their Remind information that they use for contact with the parents themselves. So if they need help, we're here. If someone needs something they have not received and they thought they should have received it by now, they can contact myself, as I said, by email. They can contact me also at 334-875-3440, and I will go through at least twice a week and pick up messages. I tend to be a workaholic, so hey.
Well, Miss Hattie Shelton, thank you so much. Cindy, do you have anything else for our superintendent?
I appreciate you coming on so much and helping us get out the information that everybody needs. Thank you.
Thank you, Cindy, and thank you, Todd. You all have a great day.
You too, Miss Shelton. We'll talk to you soon.
Okay, bye-bye.
Bye-bye. I'm going to tell you something. I really love that lady. She's doing a good job, and she's a very good person. Well, Cindy, I tell you what, why don't you once more tell everybody that may have just tuned in about yourself, the Selma Sun, and we'll wrap things up.
Right. Hey, yeah, I'm Cindy Fisher, and I'm the owner and publisher of the Selma Sun. And we are here. We are a weekly that comes out on Thursdays. You can find us in news racks and at selmasun.com. So we are just trying to shine the light on Selma, Dallas County. And we so enjoy what we do here in the community. Our Facebook page is very active, so look for us, Selma Sun Newspaper, and follow us. We are giving probably 3 or 4 stories a day, so very active.